So we know a lot about trigger points. We know what they're made of. We know a lot inside them. And of course, as technologies improve, we're able to peer deeper and deeper inside trigger points. But there's still some fundamental questions. Fundamental questions, for example, when someone's fractured their ankle, we tend to see trigger points developing immediately in some of like the peroneal muscles, the fibularis rather group around the ankle. Trigger points seem to sort of be part of the nervous system's reaction to mechanical injury. We talk about something called trigger point on demand. That's when the nervous system wants to switch something off, and the most efficient way of doing that is to produce trigger points because we know they cause host muscle weakness. The neuroplastic concept of trigger point theory is that trigger points are more than knots in muscles. They are a relationship that the therapist can have with the patient of communicating and changing the nervous system and looking at an algorithm in how you sequence the trigger points, how you put them back into the nervous system, allows you to make more profound changes. Neuroplastic because in a sense the trigger points are, the muscles are not irrelevant of course, but they're less relevant in terms of a muscle, but more in terms of the way the nervous system, the way the brain sees it, the way the cortex sees it, the way the homunculus sees it, the way the patterns are. And when we play with trigger points, we start interfering with these patterns of the nervous system, holding patterns around injury. And the neuroplastic hypothesis tells us more about using trigger points as a kind of input to the nervous system, a way of changing the way the nervous system reacts around injury and switching off the holding patterns and having extremely profound effects using the trigger points.